Hello everyone, my name is Josephine Edokwaye. I'll be presenting innovation project proposal aimed at improving medication adherence in adult patients with major depressive disorder. Problem the innovation will solve. Depression is the most widespread mental health illness affecting adults in America. Among the veteran population, depression is common, leading to a higher risk of mortality and morbidity in this population. Despite the seriousness of depression, it can be treated with medication and psychotherapy, yielding positive outcomes. Nevertheless, a significant proportion of patients with depression are not adherent to treatment, affecting their progress and effective management of the condition. At the Veterans Affairs, where this project will take place, medication adherence rates have been increasingly significant, and the facility needs an effective and innovative intervention to address this problem. The background of the problem. Military personnel are at elevated risk of developing severe depression compared to the rest of the population. Research indicates that the prevalence of depression among active military forces was 23% and among veterans was 20%. The evidence indicates that 25% of patients with MDD discontinue their antidepressant therapy in 1 month, and up to 45% discontinue after 3 months. By the 6-month mark, more than 60% have stopped their medication. Non-adherence is a barrier to depression treatment, preventing adequate response or remission. Non-adherence to antidepressant is associated with impairment in interpersonal relationships, a functional decline in work or school, and reduced quality of life. The inability to achieve adequate treatment response with antidepressants results in poorer clinical and functional outcomes. Medication non-adherence also increases the risk of developing anxiety, stress, substance use, and other mood disorders, as well as physical health problems. Additionally, non-adherence is associated with higher healthcare resources utilization and costs from increased hospitalization and emergency room visits. The development of comorbidity requiring treatment. There are different interventions that exist to deal with medication adherence. Patient education has been used in the past in this facility. However, it was inconsistent and did not take because of all providers did not educate their patients. The second intervention was screening for medication adherence as a means to determine the level of adherence. While this helped to identify adherence problem, it did not solve the problem. Innovation collaboration. I collaborated with 3 individuals for this innovation project. The first individual selected is a psychiatric and mental health nurse practitioner who is one of the senior providers in the clinic where the project will take place. She was also chosen because other providers, including psychiatrists and psychologists, as well as other MPs in the clinic, have incredible respect for her. She has led several initiatives with the clinic as well as the larger VA community. Her recommendation was that mobile technology can be an effective intervention because of its convenience and availability. She raised concerns about security and private challenges when leveraging mobile health technology. She also highlighted the need to engage providers in selling the use of mobile technologies to their patients to track non-adherence. She also noted the need to pilot tests first with a few patients before scaling up to the entire clinic and having adequate training for patients on using the app. The second person I collaborated with is an administrator at the clinic who facilitates changes that include protocols or procedures and guidelines. She collaborates with providers and was instrumental in the integration of virtual health options, including telehealth services during the height of the pandemic. She has personal management experience and can shed light on workflow with other departments that may be used to the innovation project. The administrator highlighted that cost could be a barrier to using a mobile app for adherence if it is not free. Additionally, she highlighted that time could be a barrier for providers because many are short on time and may not be open to learning about new technologies. Her advice to implementing a mobile app to address medication adherence is to consider the role that demographic factors, particularly cost, may play in such an intervention. The administrator knows that there are veteran patients who are on cellular phone plans with limited data and internet use. These individuals should be considered when implementing this kind of technology so they do not miss out. The final person I collaborated with was the clinical director who oversees the mental health outpatient clinic as well as two other clinics in the VA facility. She has expertise in implementing larger scale clinical projects in sourcing finance and human resources to execute those projects. She would also be the individual who would need to take a project of this magnitude to the leadership team for approval before implementation. The director will continue to be used in clinical practice and should be encouraged. She knows that most people have cell phones, and if cell phones can be used to improve the quality of health of patients, it is something that should be embraced by all healthcare facilities. She has direct experience of using mobile technologies, particularly with telemedicine options for patients who have not have a computer or chose to conduct virtual visits over the phone. The major concern that the director raises with implementing any evidence-based practice project using mobile technology will be the impact of the implementation on workflow and cost implications. She knows that most healthcare organizations are struggling to balance cost and quality. As such, organizational leadership would lead a value proposition showing how this technology can be beneficial to the patients in the clinic and beyond. Utilization of appropriate technology. The chosen app is My Mess app. It is a simple app that allows the user to set up medication reminders as well as tracking reports. The app is available on both Android and Apple mobile and tablet devices. It also offers the individual the opportunity to create their own circle of care. The circle of care features allows users to invite their providers and family members to view their progress. Users can also add the reason for taking each medication and delete medications no longer in use, as well as record dosage and dosage changes. One can also add restrictions about a medication and feed it any provider's instruction, such as meds to take go. The literature notes that forgetfulness and lack of time as primary reason non-adherence to medication. The use of this app will serve as an intentional reminder to patients to take their medications and help address forgetfulness and losing track of time. The app also allows patients to customize their medication reminders and to engage their providers and even their family on their medication adherence journey. Having providers and family members on the app creates accountability for the patient to take their medication and a support system. For these reasons, this app was chosen to help address this problem. Innovation solution. This project is innovative because it is leveraging technologies that have already been successful in other fields and applying it to healthcare settings. The ubiquity of cell phones have revolutionized other industries and can be used to optimize healthcare outcomes. The project is also breaking down professional silos by encouraging interdisciplinary teams to work together to improve healthcare outcomes, while also highlighting the need to prioritize patient-centered care and provide care that meets the needs of the patients. Innovation also requires breaking barriers and experimenting. There are potential hurdles that can occur with this project since it is new and providers may not be accustomed to the idea of patients using a mobile app to monitor and enhance their adherence to medications. However, innovation includes trying things that are new and being willing to improve upon what already exists. That concludes my presentation. Thank you for listening.